How you doing today, sir?
Doing fine.
Good, good, good. I'm Forrest. I'm gonna be your student physical therapist for today.
Okay.
All right, let me just wash my hands here. Now I see that you just got done with your manual lift drainage. Is that correct?
Mm-hmm.
Okay. What we're gonna do is I'm going to do some compression wrapping on your arm. This will help facilitate your manual lift drainage to keep that lymph fluid going to where it needs to go.
Okay.
Okay. Before we start, I'm going to ask you a few questions just to make sure you're a good candidate. Okay?
Okay.
All right. First off, do you have any cardiac issues?
Mm-hmm.
Okay. No heart issues? No renal issues or kidney issues? Any recent fractures?
No.
Cancers or infections?
No.
Okay, good. So what we want to do now is check your arm just to make sure there's no skin issues or irritations or infections. This is going to require me to touch you. Is that okay?
Mm-hmm.
All right. So I'm going to check here. I want to check all the way up your arm. Should we see here? Good. I don't see anything that's alarming. I want to check your fingers here and inside, in between your fingers as well. All right, looks pretty good. Now what we want to do is do what's called a sensory test just to see how everything is working on your nerves. They're going down to your arm.
Okay.
All right, what I'm going to do is I'm going to touch you, have you close your eyes. When you feel a touch, just say yes.
Okay.
We'll do both arms, okay?
All right.
Go ahead and close your eyes.
Yes. 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 Yes.
Okay, good, good, good. So we'll go ahead and get started with the compression wrapping. And I'm gonna kind of talk through the technique here just because I want to have you learn to do this as well.
Okay.
Because you may need to do this at home. Just gonna put that there for now. That's gonna come into play later on. Let's go ahead. What we're gonna do first is we're going to wrap your hand. So I want you to just remain relaxed here. All right. I'm gonna start the wrapping right below these two bony processes right here.
Mm-hmm. Don't
want to start on there. Just wrap around twice. This is what they call creating an anchor.
Okay.
Okay. Then we're gonna actually let me just start back there. You want to go toward the pinky on this. That actually helps out with the whole wrapping down at this part of the hand. So we go back around. So you wrap toward the pinky 2 times. Make sure it's nice and straight there. All right, just relax there. You want to go up to your hand here. Go right just above the bed, the nail bed line. You want to wrap around real good. Okay. Go around again. Make sure you wrap it real nice and good there. Feeling okay?
Mm-hmm.
Okay, good. And during this procedure, you just let me know if you have any questions, okay?
All right.
And at any time, if you start to run low, you want to end the wrapping on the wrist, not up here in your hands.
Okay.
You can always grab another wrap to go around. Big piece of tape there. All right. When you start with a new wrap, make sure you anchor it again. Go up just a little bit on your elbow. I'm sorry, on your wrist, not your elbow. Anchor it twice. There you go. Right up and catch the other end, the other fingers there. Almost done. Come up here. Typically, you probably want to cut right here, but since this material isn't mine, I'm just gonna continue on here. Apply a little tape. Let's get a small piece here. All right, now once you get done with this, you want to check the circulation. Go ahead and squeeze your hand. How's that feel? Any restriction, any tingling or numbness?
No.
Okay. All right, good. Want to make sure that palm is kind of open and clear. We're going to bring this back up. Now, as we get up to the arm, as we start wrapping, we want to make sure this sleeve goes up to 2 inches below the axilla there.
Okay.
All right. And we're gonna get a smaller size bandage here and start working our way up. I'm sorry, before we get to that, let's do some foam here. When you're putting on the foam, you wanna make sure that you're kind of building the arm up so that the bottom part of your arm is kind of equal size with the top part. So as you notice, your bottom part is smaller.
Mm-hmm.
So you wanna do more wrapping down toward the bottom. Then we work our way up here. When you get to the elbow, go ahead and bend. We want to make sure we put a little more cushion in the elbow here. So we're just gonna overlap. You can go ahead and rest. Overlap here. And actually, I'm gonna have you go ahead and push into my chest right there. There you go. Just slide forward just a little bit so you don't have to bend forward too much. All right, go ahead and wrap up here. And you want to wrap this kind of loosely. This doesn't have to be too tight there. Let me grab another one. Let's try it out here. Nice and loose all the way up. Okay. Kind of looking for an equal cylinder, well, not a cylinder, but equal dress in there. Gonna start with a small bandage here, smaller size. Go ahead and push into me. Start again down here toward the bottom of the wrist. Gonna go towards your thumb here. Make an anchor again 2 times around. Then as you're going up, you want to kind of go 50% overlap on the bandage there. All right, let's before we get to that, let's go that down to the thumb here. Let me get here and want to make sure that you remember to go up to the thumb. Okay. Make sure we go up here. Make a bend there. Come back around again. Okay. All right. Then we'll work our way up. Once we have the thumb, 50% overlap. This one you want a little tight. Not too tight, but a little tighter than the foam here. Go ahead and push. There you go. All right, go ahead and bend your elbow. All right, when we get to the elbow, want to make sure we're gonna do a little X here, just like the X-Men. We're gonna go around, come around the back, then come back down. That helps with the function of your elbows. You can bend a little bit. And we'll continue to go up. Okay. We get a piece of tape here. If you have to use a second bandage, which you probably are, start with a longer one. Come it down here. We get our anchor again. And we start going up. Again, 50%. 50%. Doing okay?
Mm-hmm.
Okay. We get all the way up. It's right 2 inches, 2 fingers below the axilla area. All right, that looks good there. Let me go ahead and move back down. Just a little bit here. Now this bandage will start to get a little grimy and dirty after a while, so we want to make sure you're washing it. You can hand wash it. You don't want to put it in the washing machine or anything. Think you'll be able to wrap this if you had to do it on your own?
I think so.
Okay, maybe.
I might take a time or two seeing it, but I don't think I'll get it.
Yeah. Go ahead and bend your arm. Okay. Reach the back of your head. Okay. Squeeze your fingers. Yeah, let me check the area here. Any numbness or tingling? Perfect. When you leave, if you do find yourself getting any numbness or tingling in this hand, just take it off. And we can rewrap it when you come back. Make sure that if you're taking a shower, you don't want to take extremely hot showers. Make sure you wrap this up with a trash bag or some kind of plastic. You don't want to wear any tight clothing, and try not to lift two objects that are too heavy on his arm, no more than like 10 pounds. And another thing, when you come back, we're going to work on doing some exercises, and we're going to show you how to wash it as well, okay?
Okay.
All right, any questions for me? All right, good. Thank you, and I'll see you next time.
All right. Thank you.